So hi everyone, a blessed day to all of you. Praying that all of you are safe and doing well together with your families and loved ones. So this is the third week of your N101 Health Assessment course. So in this presentation, I will explain to you how to obtain the health history of your client. All information gathered during your health history taking are considered subjective data. When we say subjective data, these are the information from the client's points of view, and it is termed as the symptoms. It includes the feelings, the perceptions, and the concerns of your patient that you obtain through interview. So during health history, this is the chance of your patient to tell his or her story. These are the learning objectives of this presentation. At the end of this session, the students will be able to explain the four types of histories and when each used, and then describe the component of comprehensive health history, and finally, the student will be able to obtain a comprehensive health history from a patient. So there are four types of health histories. So how much data to gather depends on the purpose of your patient encounter. For example, in the admission of new patient in the clinical setting, could be in hospital setting, like in the emergency department or in the outpatient department, or could be in the health center. Okay, basta new admission yung client, it may require a comprehensive assessment. Okay, a comprehensive assessment meaning you have to collect a complete data about your client. Okay, this data will provide the nurse a full picture about the patient. So as I mentioned in our previous discussion, health assessment is like opening a box of puzzle wherein you have to take out the pieces of the puzzle, and those pieces of puzzle are similar to the history of your client. You have to connect it for you to be able to see the whole picture of your patient, for you to know who your patient really is. That is for you to be able to determine the health status of your client as well as the health promotion that might be necessary later on and the possible health risk of your client. Okay, a comprehensive assessment includes the current problem of your client, the past history or the past medical history of your client, the family history, the review of system, the health pattern, and so on. Okay, so another type of health history is the focused or problem-oriented assessment. Okay, this type of assessment is appropriate in many situations, particularly if the patient is known to the nurse or to the healthcare facility. For example, uh, the patient was hospitalized for surgery and later on, the patient developed complications like shortness of breath post-operatively. Now, the patient went back for consult about her current situation. Meron siyang shortness of breath. Okay, so this time, yung assessment ni nurse must focus on the current problem, shortness of breath. So, you might consider assessing the respiratory system of your patient. And then another type of health history is the follow-up history. This is just a form of your focus or problem-oriented assessment. Okay. So, for example, yung, yung morning duty nurse, okay, meron siyang nakitang problem doon sa kanyang patient na may shortness of breath. Okay, yun na ulit yung example natin. Or may fever si patient. Okay, so, gumawa siya ng kanyang nursing care plan para sa patient care doon sa kanyang patient. So, kapag endorse niya kay patient doon sa afternoon duty nurse, Okay, in-endorse din niya na si patient nagkaroon ng shortness of breath, nagkaroon ng fever. So, yung afternoon duty nurse naman, meron na siyang baseline. So, ibig sabihin, meron na siyang baseline data. So, this time, follow-up history naman yung gagawin ni afternoon duty nurse. So, i-check niya kung may fever pa rin si patient, kung may difficulty of breathing pa rin si patient, or may shortness of breath pa rin si patient. So, nakafocus na siya doon sa current problem. Okay? And then, another one, or another type of health history is the emergency history. Okay, so this type of history is applicable during emergency situation. Like for example, sa emergency department, merong dinalang patient na na-aksidente. Okay, so yung assessment ni nurse must focus on the emergent problem. So the nurse must know how to prioritize, no? Dapat marunong siyang mag-rapid assessment of the client, kung ano yung life-threatening na kailangang aksyonan kaagad. Okay, for example, the nurse may assess the client through assessing the circulation, the airway, the breathing. If you suspect cardiac arrest, no? Nagpunta doon si patient, parang may cardiac arrest, so you have to check the circulation, the airway, and the breathing. Yan. So let us compare comprehensive versus a focused assessment. So for comprehensive assessment, and again, this is usually done for new patient in all settings. So kahit saang settings, could be again in the health center, in the clinic or doctor's clinic, or in the hospital setting. It provides the fundamental and the personalized knowledge about your patient, and then this will also strengthen nurse-patient relationship because you will know your patient well. Okay, you will know the history of your client, the family history of your client, and etc. It will provide a baseline data for the nurse to create the nursing care plan about the current problem of your patient. It creates platform for health promotion. Okay, for the focus assessment is establish patients, especially routine or urgent care visits. So, na-mention na natin kanina na nakafocus tayo sa current problem because we already have the baseline data about your client. The focus concerns or the symptoms, yun yung ating bibigyan ng pansin. And then you have to assess the symptoms restricted to specific body system. So, katulad ng example ko kanina, if the patient complain of shortness of breath, you might consider assessing the respiratory system. Ano ba yung malapit pa aside from the respiratory system? The cardiovascular system, baka involved, or the gastrointestinal system, kung bakit nagkaroon siya ng difficulty of breathing or shortness of breath. Okay, you have to assess those systems that might be affected or might be involved in the current problem of your client. Okay, these are the components of your comprehensive adult health history. So you have to begin again in identifying data. No, it includes demographic data and the source of the history. So an example of your demographic data, the name of your client, the age of your client, birthday, and so on. The chief complaints, okay, the reason of why the patient visit your clinic. Could be sasabihin ni patient, so masakit po yung ulo ko. History of present illness. Okay, 3 days prior to consult or prior to admission, the patient experiences pain or meron siyang fever. Yan. Past health history. Okay, nagkaroon ba ng hypertension, diabetes, and etc. Personal or social history. Smoker ba? Alcoholic drinker ba si patient? What is the occupation of your client? And etc. Family history. Meron bang history of hypertension sa mother side, father side, and etc. again. So review of the systems, the 12 system from head to toe, from general appearance and so on and so forth. The health pattern, the sleeping pattern of your client, okay, ilang oras siyang matulog, elimination pattern, and etc. So isa-isahin natin lahat ng mga component of your comprehensive adult health history in the next slides. Okay, so sabi natin kanina, part of your comprehensive adult health history is the demographic data. Okay, meron tayong initial information, and part of that is yung date and time of history. Do not forget to write the date and the time that you perform or you do the interview. And then the identifying data or your demographic data, the age, the gender, the birth date, the marital status or relationship status, the occupation of your client, and other appropriate information. Who is the source of the history? Is it the patient itself or the parent, the siblings, brother or sister, and who else? Okay, is the history or the data reliable? Okay, so si patient ba reliable ang kanyang sinasabi? Is the patient conscious and coherent? Yeah. So this is an example, no? So the name of your patient, Mario Ong, age is 45. Marital status, single, birthday is January 1, 1976. Occupation, vendor, and the source of the information is yung brother niya. Source is reliable. Bakit natin nasabing reliable? Kasi yung depende rin yun sa pananalita ng pasyente, and then the patient is living with yung source of information is living with the patient. Okay. Example of how you will state the demographic data. The patient is Mario Ong. Okay, 45 years old male, single, from Quezon City. Born of January 1, 1976, and is a vendor of balut. The source of information is the patient himself. Bakit sinabi natin ditong brother kanina? Kasi, who appeared drunk during the interview. Okay, kung drunk si patient, tingnan mo kung sa tingin mo ba gaano kalasing yung pasyente. Sa tingin mo ba yung mga sinasabi niya is reliable? Okay, consistent ba ang kanyang mga sagot? Or is there a flight of ideas during interviews? Yeah. So another component of your comprehensive adult health history is the chief complaint. You have to make every attempt to quote the patient's own words. Ano ba yung sinasabi natin kanina? Example, sabi ni patient, nilalagnat po ako. Ayan, you have to quote that sentences. Yung sinabi ni patient, nilalagnat po ako. If there are no complaints, or you have to report goal, or you have to explain to the client the reason or the purpose of the interview. Another component is the history of present illness. Okay, when you take history of present illness, it must be in chronological account of problems. Meaning, sunod-sunodin mo yon. Okay? For example, kailan nag-start? You have to utilize your old card technique. Diba? Yung the 7 attributes of symptoms. Okay. The onset of the problem, stands yung O natin. And then, the location, the duration, okay, the characteristic, aggravating factors, the relieving factors, and the treatment. In other book, yung old card, meron pang S, old cards. So, yung S stands for severity. Okay. So, this is another example of your chief complaint, no? History of present illness using the old card. So, onset, 3 days prior to consult. Okay, the patient has, ano ba yun? May characteristics no watery, 6 times a day, brownish, foul-smelling stool. Yan. Associated symptoms, nagkaroon ng fever si client. So, old card again, kasi this is another symptoms. So, gagamitin nyo ulit yung old card. Yung onset, kailan nag-start yung fever. Yan. Applicable ba yung location? Okay, so usually whole body yan. Abdominal pain, so same then, you have to utilize your old card technique. Nausea. Okay, what are the relieving or aggravating factors? No relieving, no aggravating factors. Treatment, the patient took Diatab 3 tablets. No relief. So tuloy-tuloy pa rin. May diarrhea pa rin si patient. Okay. So from the data gathered in the previous slides, this is how you will state your history of present illness. Okay, state natin into paragraph 4. 3 days prior to consult, the patient experienced watery diarrhea 6 times a day, characterized as brownish and foul-smelling. The diarrhea worsened with intake of oily food. Yun yung aggravating factors. The patient also experienced fever, abdominal pain, and nausea. The patient took 3 tablets of loperamide, which did not bring relief. 2 days prior to consult, the patient had fever. Continuous. Okay? Yung temperature of your client, 37.9 to 40.5, the range of the temperature of the client. No associated symptoms. Relieved by taking paracetamol, 1 tablet every 4 hours. 2 days prior to consult, the patient had abdominal pain and etc. Okay. So another example of your comprehensive adult health history, HPI. Okay, onset 4 days prior to consult. The location, mayroong right mid-clavicular line, second intercostal space, chest pain. No? Duration, 2 minutes every time I cough. So yun yung aggravating factor. No? Characteristics, no difficulty of breathing with chest pain. 5 on the pain scale. So, you assess to gaano ba kasakit yung kanyang pain. So, you ask the client, you rate your pain as 0 as no pain, 10 as the worst pain. Associated symptoms, no other symptoms. The relieving or aggravating factors, okay, nagkakaroon siya ng chest pain kapag may cough. Coughing aggravates the chest pain. So, treatment, no medication taken. So, another example, onset, 2 weeks, characteristics with yellowish phlegm, non-blood streak, non-foul smelling. So, may cough si patient. Okay? Associated symptoms, chest pain, fever, no headache, no colds. Relieving or aggravating factors, riding public transport aggravates cough. So, because probably of the pollution, no? Or yung mga environmental factors. Treatment, Lagundi tablet. Okay? Tablet 3 times a day. No relief si patient. Okay. So another component of your comprehensive adult health history is the past history. And the component naman ng yung past history, one of those components is the childhood illness. Okay, so check natin, no? 9 years ago, no unrecalled medications. 9 years ago, the patient had dengue. Patient was hospitalized for 3 days. Patient was given unrecalled medication, unhydrated, no transfusion. And then 10 years ago, nagkaroon ng pneumonia. Patient was hospitalized for 4 days. The patient was given unrecalled medication. 2 years ago, the patient has otitis media, given ear drops. Unrecalled patient had measles but unrecalled. Okay, when? And the medication, hindi niya ma-recall. No mumps, no chickenpox. Yan yung childhood illness niya. Okay, so another example of the past medical history, no? 2001, the patient had or was diagnosed with goiter. So iodine therapy, ang kanyang medication, it was resolved. In 2015, the patient has hypertension, type 2, Okay, the medication was losartan 50 milligram and amlodipine 5 milligram once a day. In 2020, the patient uh, had gastritis. No, omeprazole 200 milligrams 2 times a day was her medication. Symptoms come back. Okay, 2020, the patient was diagnosed with diabetes mellitus type 2. She was given a metformin 50 milligrams once a day. No heart disease, no respiratory disease, and no cancer. Okay, past surgical history as part of your past history. In 2018, the patient underwent appendectomy. So the medications was unrecalled. There was no complication. And then you have to obtain the OB history later on in the next slides. So you have also to check the allergies of your client. So no other allergies. Okay. So again, sa comprehensive adult health history natin, sa HPI natin, yung kanina, yung history of present illness, these are the key elements. So na-mention na natin yan in our previous discussion. Okay. So another key elements of your past history, you have to check if the patient has allergy, and you have to be specific, no? Include a specific reaction to medication, to food, insects, and environmental factors. Ano ba yung naging reaction? Nagkaroon ba ng rashes? Nagkaroon ba ng difficulty of breathing? Na-hospital ba si patient? What are the medications given? So, another key elements of your past history, the medications, diba? So, ano yung mga tinake niya ng mga prescribed drugs, no? Katulad ng ating example in the previous slides, nag-losartan si patient, that is an example of prescribed medication. Over the counter, yung uminom lang siya ng lagundi, yan, or herbal supplements, no, lagundi pa din. Vitamins, minerals, or supplements na kanyang tinitake. Oral contraceptives, meron ba? Medications borrowed from family members or friends, nakiinom siya. Kasi si patient, yung kanyang relatives, meron ding hypertension. So, pareho daw sila ng blood pressure. Kaya nakiinom din siya kung ano yung tinitake ng kanyang kaibigan or kanyang kamag-anak. Okay? So, again, another elements of your past history is the childhood illnesses, as mentioned again in the previous slide. So, these are just some examples of childhood illnesses. Okay, when you ask your client, nagkaroon po ba ng measles? Isa-isahin pause muna, no? Para makapagsagot si patient ng yes, no. Rubella, pause, mumps, whooping cough, chickenpox, rheumatic fever, scarlet fever, polio, okay. And then, chronic conditions, nagkaroon po ba ng asthma? Okay. Another key elements of your past history, no, aside from childhood illness, are the adult illnesses. Okay, medical. No, ano ba yung medical? Katulad na lang ng hypertension, cardiovascular system problem, diabetes, goiter, so example of the medical history. Surgical, nagkaroon ba ng previous surgical procedure like appendectomy, cholecystectomy, and etc. Accidents, minor, major accidents, psychiatric problem, nagkaroon ba ng depression, nag-consult ba sa psychiatrist, what are the medication given, na hospital ba? Yan, those are example questions. No? So let us now move on to our OB/GYN history or menstrual history or OB score. So pagpasensyahan na yung ating font. Okay. So menstrual history. No, you have to take note of the following terms. G stands for gravida or the number of pregnancies. Para or P, letter on, a number of births after 20 weeks. Para parity yan. 5-digit system, yung GT-PAL natin. So again, G stands for the total number of pregnancies. viable or not. Okay? Nabuhay o hindi. Yan. So, number of pregnancies yan. T stands for full-term pregnancy that usually reach 37 to 40 weeks. So, depende sa inyong references. Other references, ina-accept pa hanggang 36 weeks to 40 weeks. Preterm delivery is 20 to 35 weeks or to 36 weeks. A stands for abortions and miscarriages before 20 weeks. Okay? L stands for living children. So you have to take note of this term kasi in the next slides, we'll see how you will read or how will you do OB scoring. Okay. So here is an example, no? OB score. Gravida 1. Okay, unang pregnancy, unang pagbubuntis. In 2010, nagkaroon ng abortion, no complication. Second pregnancy, gravida 2. In 2012, full term, it was delivered via cesarean section. There is a complication, no? Bleeding patient was transfused with 2 packs of blood and the baby is alive. So, paano natin gawin yung OB scoring natin? The GP-TPAL, no? Okay, gravida 1, 2, dalawang pagbubuntis. Gravida 2, parity, yung umabot sa viable age, di ba? Yung umabot ng 20 weeks. Okay, so meron ka dito full term. So, meron kang 1. Okay. And then, TPAL. Okay, TPAL term. Yes, meron tayong isang full term. Preterm. Wala tayong nabanggit na preterm dyan. Okay. A stands for abortion, no? TPAL, abortion. So, meron kang isang abortion. So, meron kang 1. And then, alive naman yung second pregnancy. So, meron kang 1. So, yung score mo is 1, 0, 1, 1. So, we'll have another example again. Okay, gravida 1 to 4. Okay, in 2002, full term, normal spontaneous delivery, no complications, and the baby is alive. Ibig sabihin, vaginal delivery to. Okay, gravida 2, 2002, preterm. It was delivered via cesarean section. No complication, but then the baby died at 3 days. Okay, gravida 3, pangatlong pagbubuntis in 2005. Full term, it was delivered by a normal spontaneous delivery or vaginal delivery. No complication, the baby is alive. So, may dalawang alive ka na. So, gravida 4 in 2020, abortion, no complication. So, paano na yung scoring natin ngayon? Gravida, ilang beses na buntis? So, pang-apat. Okay, 4. Umabot sa viable age or parity or para, ilan ba? May full term ka? May isa kang preterm? May isa kang full term? So, 1, 2, 3. So, kaya 3. No? Hindi na natin kasama ibilang yung abortion kasi hindi yan umabot sa viable age. Sa TPAL term, ilan ang term? Full term. Okay, sa 2001, 2005, so meron kang 2. P, preterm. Yan, meron kang isang preterm kaya may 1 ka. Abortion, A, meron kang isang abortion kaya may another 1. So, living or L, 2 ang alive, no? Yung pinanganak noong 2001 and 2005. So, your OB score is G4P3 2112. Okay. So, again, ito yung ating mga tatandaan. Okay. Full term, 36 to 40 weeks, preterm, 20 to 35 weeks, abortion, 1 week to 19 weeks, tapos yung age of viability natin umabot ng 20 weeks. Okay, another example pa. Okay, gravida 1 or unang pagbubuntis in 2001, full term via cesarean section. There is no complication. The child died at age 5 due to dengue. In 2003, pangalawang pagbubuntis, gravida 2. So, nagkaroon ng abortion. So, paano naman yung OB score natin? Gravida 2 kasi nakadalawang pagbubuntis. Yung para, yung umabot ng parity or yung viable age, isa lang kasi abortion yung isa. Sa TPAL term, may isa kang term. Preterm, wala kang preterm. Abortion, may isa. Walang living kasi namatay naman yung G1, unang pagbubuntis, at aborted yung pangalawa. So, OB history, menstrual history naman ito. Menarche or the first menstruation. So, kailan nagkaroon ng first menstruation? 13 years old. Yung kanyang last menstrual period was on January 20, 2021. Ano po ba ibig sabihin ng ating last menstrual period? So, yung kailan siya huling nagkaroon, yung first day, no? Yung first day nang huli siyang nagkaroon. Hindi po yung bibilangin mo, kailan nga ba yung huli ako nagkaroon, yung huling patak. Hindi yung huling patak. Halimbawa, last month, yung kanyang last period, anong unang araw nung last month? Okay. Ano ang duration? So, 5 days. Okay. 3 fully soaked pads per day. No dysmenorrhea. Yan. Kaya tinatanong natin si patient, usually nakakailang packs ka per day? Soak ba ito? Nakailang pad ka? Yan. So let us now proceed to another component of your comprehensive health history, the personal or social history. Okay. So part of your personal or social history is to check or to assess the patient's use of alcohol or drugs. May misuse ba? Okay. So that contributes to the symptoms of your client kung bakit nagkaroon siya ng headache or bakit nagkaroon siya ng problem sa liver. Okay, you have to ask the client. Okay? Paano natin ito itatanong? Diba? Kasi medyo sensitive to. You need to gain the trust of your client para magsabi siya ng kanyang ng totoong data. Magbigay siya ng mga true data to you. Okay, so you can start by asking your client, what do you like to drink? Ngayon, sasabihin mo ngayon, mahilig ka po bang uminom ng soft drinks, ng coffee? Okay, tapos ipapasok na natin yung mga alcoholic beverages. Ngayon, pag sinabi na ni client yun, meron kang nakita na ako umiinom ng alcoholic beverages. Maybe you can ask your client, can you tell me more about your drinking or about you using drugs? Okay? So, pwede nyo itanong. Sa drugs naman, paano mo naman itanong to? Maybe you can ask your client, okay, did you use any drugs aside from those drugs that are used for medical purposes? Yan. Okay, and then you should routinely ask about the current and the past use of alcohols or drugs, the patterns of use, and the family history. So, pwede mong itanong kay patient. Okay, at tuwing kailan ka umiinom? Sabi ni patient, occasional lang. And then, you have to ask your client, can you tell me what do you mean by occasional? Baka naman yung occasional niya every other day. Okay. And then you can ask the client, when was the last time you take alcohol or you take drugs? Ayan. And then, you ask about the family history. Meron bang umiinom sa pamilya or meron bang gumagamit ng ipinagbabawal na gamot in the family members? Okay. So, you also include adolescents and older adults in your questions. Diba? Hindi lang porket, adolescents to, hindi pa to umiinom. Or matanda na ito, hindi na rin ito umiinom kasi senior citizen na to. Okay. So, kasama din sila, no? Kasama rin sila na i-assess natin yung kanilang use of alcohol and drugs. Okay. So, for alcohol, you have to assess what patient considers alcohol. So, tingnan natin, baka mamaya para kay patient, soft drinks lang yung red wine, soft drinks lang yung beer, diba? Baka para sa kanya, ang alcohol are yung mga gin, diba? Okay, so you have to assess kung ano yung alcohol para kay client. Or baka naman yung alcohol para sa kanya, yung pag tinatanong mo siya, may inom po ba kayo ng alcohol? Sabi niya, naku, hindi. Naku, hindi ko inom yung alcohol. Pang disinfect kasi yun. Diba? Okay, you have to be clear of your question. Okay, for you to know kung meron bang alcohol problem or alcoholic ba yung patient, we can utilize the screening tool that we call CAGE. Okay, yung CAGE is you will be asking question to your client. These are the example question. Have you ever felt the need to cut down on drinking? Naisipan mo na bang huminto? Cut down, so letter C. Have you ever felt annoyed by criticism of your drinking? Okay. So, nahihiya ka na ba dahil maraming nagko-complain sa pag-iinom mo? Have you ever felt guilty about drinking? Pagkatapos mo bang uminom, naging-guilty ka ba dahil imbes na ibili mo ng pagkain or bigas yung pera mo, ibinili mo ng alak? Have you ever taken a drink, first thing in the morning or eye-opener? Okay, pagkagising mo ba sa umaga, iniisip mo na kaagad na uminom para lumakas ka or para mawala yung hangover mo. So, kaya cage, cut down, annoyed, guilty, or eye-opener. Sorry, natakpan ng video. So, for alcohol, okay, so chine-check natin, example, assessment ng alcohol. So, alcohol, umiinom si patient ng tequila, 1 small glass once a month. Once a month lang daw. So, pero nag-assess ka ng CAGE, tinanong mo yung 4 questions kanina, naka-4 si patient. So, ibig sabihin, may problem. So, about drug intake naman, nagmamariwana si client but discontinued 10 years ago, umami naman siya. Smoker din si client, nag-i-smoke siya ng 3 sticks per day for 10 years. Yan. Okay. So, a continuation for your alcohol, positive yung CAGE results kapag naka 2 or more affirmative answers doon sa 4 questions natin. If na-detect natin na may misuse of alcohol or drugs, as about nagkakaroon po ba ng blackouts, seizures, accidents, injuries while drinking, job problem, natanggal ba sa trabaho, okay, conflicts, nagkaroon ba ng away between your family members, legal problems, or naireklamo ba sa barangay dahil nagwawala, or pinagkahampas yung mga halaman ng kapitbahay, and etc. Okay? Okay, so let us now proceed to illicit drug or ipinagbawal na gamot. Okay? You can start your questions by asking focused questions to distinguish use from misuse. Okay, so yun nga katulad ng questions natin kanina. So aside from the drugs that are prescribed or used for medical purposes, do you use any other drugs? Okay. Adapt CAGE question by adding or drugs. Instead na alcohol, papalitan mo yung 4 questions kanina. Have you ever felt annoyed, about using drugs? Yan, papalitan mo lang yun. Okay? Ask about patterns of use. Okay, tuwing kailan po kayo nagda-drugs? Every day, every other day? Ask about modes of consumption. Is it orally taken, injectable, or sinisinghot? Yan, para alam mo what kind of drugs yung ginagamit ni patient. So, to compute for pack per years, for the smokers, okay, to compute it, you have to pack per years, number of cigarettes per day times number of years of smoking, okay, so divided by 20. So, halimbawa, sinabi ni patient, nagsismoke siya ng 20 cigarettes per day or 20 sticks per day. So, naka 3 years na siya na nag-i-smoke. And then, 20 times 3, so that is, 60 divided by 20. So, meaning, per year, nakakapag-smoke si client ng 3 packs per year. Okay. So, another component of your comprehensive health history is the family history. Okay, so this is an important part of your health history because an accurate information about the history of the family members will provide you as a nurse to know the possible health risks of your client. Okay, yung family history, this will includes the family member or immediate family member, the mother, the father, grandparents, yan, siblings, children, grandchildren, yun, mga immediate family members. Okay, for example, yung father, no diabetes mellitus, merong hypertension, may heart disease, no respiratory disease, no cancer. So, mother side naman, yung history, no diabetes mellitus, no hypertension, no heart disease, no respiratory disease, no cancer. Yung siblings, all are well. So this is an example of genogram. Okay? Ito yung mas madali daw gagamitin when you do your family history. Mas madali kasing i-identify or i-trace kung ano yung mga possible risk problem na pwedeng ma-develop sa patient. Okay, these are the genogram key, no? Ito yung circle represents the female. Okay, the square, it represents the male, and then the diamond shape, unknown. Okay, yung circle or square na merong line in the middle, it is a symbol na yung female or yung male died na. Then yung may arrow is the patient. Okay, and then and so on and so forth. Okay. So for this example, tingnan natin, no? We will trace the family history of our patient. Sino yung patient natin dito? Our patient here is the 57 female kasi circle siya. So ito yung patient natin. Yung patient natin, meron siyang hypertension. Okay. So tingnan muna natin yung history ng ating patient. Okay. So the patient is married. Ang kanyang husband is 59 years old. Pareho silang may hypertension. They have 3 kids, no? Merong isang female at merong 2 males. All are alive and well. So, walang mga sakit yung kanilang mga anak. So, let us trace the history of our patient. Okay. So, tingnan natin yung mga immediate, no? Yung sa bloodline ni ang ating patient. So, yung ating patient, meron siyang isang brother. So, dalawa lang silang magkapatid. Yung brother niya is 53 years old, merong myocardial infarction and hypertension. So, i-trace natin ang kanilang parents. Yung kanilang parents, parehong patay na. Both died. Due to myocardial infarction. Pareho no, male. Yung mommy and yung daddy, parehong namatay sa myocardial infarction and hypertension. So, i-trace natin yung kanyang father side. Yung kanyang father side, merong 2 kapatid. Both living pa. Buhay pa. Yung 2 kapatid ng kanyang father. Pero yung 2 yun, merong myocardial infarction at coronary artery bypass graft. Okay, pareho sila, no? Yung CABG. Tapos yung isa, yung brother ng kanyang father, merong hypertension. I-trace naman natin yung kanyang grandparents, no? Sa kanyang father's side. So, yung kanyang grandmother namatay at the age of 86 due to myocardial infarction. And yung kanyang grandfather sa kanyang father's side namatay at the age of 56 due to cerebrovascular accident. So, meron talaga silang problem sa hypertension, CVAD, diba? So, high risk ang ating patient. Okay, tingnan naman natin yung kanyang mother side. Ang kanyang mother side, meron ding myocardial infarction and hypertension, yun yung cause of death ng kanyang mother at the age of 85. Okay? So, yung kanyang grandparents sa side ng kanyang mama. So, yung kanyang lola died at the age of 57. So, medyo bata pa due to CVA or cerebrovascular accident and hypertension. Yung kanyang grandfather sa mother's side died of CVA at the age of 60. So, madaling tingnan, no? So, kitang-kita mo kaagad may mga hypertension, may mga hypertension. So, it runs, okay, in the blood. Okay? So, another component of our comprehensive health history is the health maintenance pattern. Okay. Itong mga to, may mga maraming examples sa inyong book on page 79. For the self-perception, ano ba yung kanyang tingin sa kanyang sarili? Low self-esteem ba ito? Very high naman yung kanyang self-esteem? Very positive ang kanyang outlook? Yan. Value or belief. Ano ang kanyang paniniwala? Ano ang kanyang pinapractice na values? Activity and exercise. Yung patient pa natin, ano yung kanyang work, no? Is it sedentary lifestyle? Nag-exercise ba si patient? Nag-attend ng yoga classes, Zumba, nagjo-jogging, or nagjo-gym? Sleep and rest pattern. So, ilang oras matulog si patient? Well-rested ba siya? Nutrition. Ano yung kanyang common na kinakain. Ano yung common na kinakain ng family? Mahilig ba sila sa pork? Mahilig sa beef? Paano mo malalaman yon? By food recall. No? Pwede kang or food history. Okay, tatanungin mo kahapon, ano po yung ulam nyo? Ano yung kinain mo in the morning? Breakfast, lunch, dinner. So makikita mo, ay puro pork, walang gulay, walang vegetable. Okay, role relationship. Okay, so kumusta naman? Divorced ba? Or may problem with the family member? So marami pa tayong examples. So coping. How does the patient cope in the presence of stress or problem? Ano yung ginagamit niyang coping mechanism? Yung iba, pumupunta po ako sa church through prayer, or yung iba, nag-exercise po ako, or kumakain ako ng mas madami, or hindi ako kumakain. So, there are different techniques, or there are different coping mechanisms. Okay, this ends our the first part of your health history. These are the references, and there will be another video, a continuation of your health history taking, the part 2, no, for this week. So thank you everyone for your time. Okay, let me end this first presentation by reading the quote by Caroline. No? The character of a nurse is as important as the knowledge that she possesses. Again, thank you very much. Thank you for listening. God bless everyone.